This is a KX News special report.
Good afternoon and welcome. Today I want to start out with a story of good news, the good news segment of our day. North Dakota, of course, has always got great examples of neighbors helping neighbors and volunteers literally coming to the rescue. Yesterday we talked about the fact that we were using our DOT to haul semi-loads of personal protective equipment around the state. Of course, everyone also knows that yesterday was a blizzard in most of North Dakota. We did have one of our trucks slide off the road in east central North Dakota when it was en route to the Deaconess Health Center in Northwood and Sanford Health in Mayville. But without hesitation, the Findlay Fire Department took out one of their vehicles. Of course, it's all volunteers there in Findlay. They collected all the PPE, they sorted it out by invoice, and they delivered it to the hospitals. So again, this is just a great example of North Dakotans stepping up during this time of emergency and doing whatever it takes. And also fun in the small state that we live in, where you say everybody knows everybody, but we got this news from my lifetime friend and fraternity brother Tom Ingen, who grew up in Northwood. He was a Northwood Trojan, another great athlete in high school, but he longtime EMT, and he called into our emergency operations center after they received their PPE at Deaconess and reported the great assistance he'd received from their former arch rival Findlay. So they fun to see everybody collaborating and working together, but I want to express my gratitude to the Findlay Fire Department volunteers and their North Dakota strong, North Dakota smart attitude in getting out and helping their fellow North Dakotans at a time of need and during some pretty tough winter conditions in April. Today, the North Dakota Department of Health confirmed 14 additional cases of the novel coronavirus disease, COVID-19, including our first case in Slope County, which was previously a county where we had not had any testing. The total now stands at 173 confirmed cases. And again, for those tracking at home and on the media, this represents a 24-hour set of tests that were collected yesterday, Thursday, April 2nd. That also then sets a record, which again, very excited about. Also in the good news category, because one of the ways we work our way through this is through enhanced testing. We'll be talking more about that during this conference, but yesterday was the highest number of total tests yet in a single day, 818. And of course, with only 14 positives, it is also means that our rate of positive cases is remaining low. 29 individuals have been hospitalized, including that's plus one from yesterday. 12 individuals added to the recovery list, which is a good news going forward. As we go through this, one of the things that people want to pay attention to is the rate of hospitalizations versus the rate of people coming out of the hospital, because it's the net of those two numbers that's going to guide our hospital surge modeling and planning. Also good news, no deaths to report today, but we still remain at 3 so far during this emergency. In terms of again, the guidance that we want to give to everybody in the state, we're under North Dakota SMART. We're staying with the same guidance, which is stay home, stay healthy, and stay connected. We made it through the 15 days nationally of the slow the spread, and now we're in another 30 days to slow the spread, if you will. These White House recommendations are aligned with our own recommendations, and again, avoid crowds and social gatherings of more than 10 people. Wash your hands after touching frequently used items and surfaces. Again, if you've got kids, whether it's playgrounds or shared toys, whatever, disinfect surfaces, whether it's phones, doorknobs, tables, handrails. We're encouraging people to work from home if you can. Follow CDC guidelines if you must go to work. And then again, if you have any symptoms whatsoever, if you've got a cold, if you've got a cough, shortness of breath, aches or pains, again, we especially want you to self-isolate, meaning, stay at home. And if you're feeling those conditions, good time to start keeping your log, because if you get worse, you get a test, you're positive, our contact team will be calling you and saying, hey, who have you been in contact with? Because we want to save lives by tracking where the spread may have gone. So anyway, that's same guidance we've been giving. And again, we have people that have had concerns that we're not doing enough, but let's just recap what we've already done, which is, again, our first case was March 11th. The very next day, we released recommendations for events and public gatherings, noting that if we got to, widespread community send, authorities would cancel or postpone events, and that's been done, and we've had great proactive action, whether North Dakota High School Association making very tough decisions about canceling basketball tournaments, churches making tough decisions, canceling, tribal leaders making very tough decisions to close their casinos, but we've had, great collaboration around closures and gatherings that would have affected that. I know that people are saying, well, why did we close all that stuff? Again, talking to other governors and talked to Premier Moe from Saskatchewan early day, they had a cluster of 35 cases that all related back to one snowmobile rally that they thought, well, hey, it's outdoors and we're going to be okay, but a lot of people were gathering, during that event or after that event. So just because you're outdoors doesn't mean you can't transfer. It's about proximity. And in the northeastern part of the U.S., I was on a call again with the Governor Phil Scott from Vermont, where they had a deadly outbreak in a nursing home with 7 deaths, but there's also an incident there where over 60 people that attended the same funeral all came down with it. And so again, that is just if people are wondering why we canceled large events, it's because you could have one person transferring it to a lot of people at a large event, and then it can quickly outscale our capacity for controlling this epidemic. On March 15th, just 3 days later, we closed schools for a week, and then we had great collaboration, as you know, with our education leaders across the state, developing distance learning programs, and so kudos to all of them. All those plans are in. All of them are approved. They're all up and going on March 1st. On March 19th, we made the tough decision about restaurants, bars, gyms, and health clubs and movie theaters closed except for takeout, delivery, and curbside pickup. March 20th, our unemployment change assurances, we've made many changes to cut through red tape and reduce the bureaucracy to help get relief to people faster, but those began right away. But we did make a bunch of changes on unemployment on March 20th. March 22nd, we closed schools indefinitely and implemented the distance learning. We waived, March 26th, we're waiving requirement on physical polling locations, allowing counties to conduct mail ballot only elections only. And March 27th, again, another decision that we reached only after considerable thought and consultation with the industry, but we closed, hair and nail beauty salons, tattoo parlors, tanning salons, massage facilities, and we limited access to state buildings to appointment only. And on April 1st, we extended the business closures to April 20th. I go through all this because there still is a call among some on social media that the state is not doing enough, and I just would ask people to kind of dig under the covers because there's been national press about who's got shelter in place and who doesn't have shelter in place. But some of the shelter in place that some states have done, if you get on the covers, they've still got personal care, hair salons, and nail salons open, but they got a shelter in place in order. So you have to get past the labels and actually look at the orders that are underneath them, and then you actually have to look at the activity that's going on, and then you also have to look at the geography and the demographics. North Dakota's got a natural advantage for keeping physical distance because we do have, we are one of the, we're low population states, and we're a large low population state. So, for example, we might have, similar population to a Vermont, but we've got 3 to 4 times the amount of geography where people are spread out. So with and if you'd even take a look at the spread, the rate of spread, which some of the modelers have at the rate of spread in a New York City versus a Los Angeles, which is similar populations, but New York's got about 3 times the density than a Los Angeles does in terms of number of people, and you can look at that, but we do have some natural advantages. So I just want to again thank North Dakotans that are following the guidance and are being smart about all of this. But I want to be clear for those that are suggesting that we're not doing enough, to make no mistake that I will use every tool at my disposal as governor to protect the lives and safety of North Dakotans. But I'm only going to use those tools if it makes sense and when it makes sense. And these are decisions that we review every single day based on the data, the information that we're getting, both the analytical data, the testing data, observing other states, and also all of the calls we're having with business leaders and mayors and civic leaders and school districts and whatever. We're getting information and feedback like probably no other time at any crisis in terms of the amount of information flowing into our office. So we have a lot of inputs in addition to the surface area and the context that our governor's office team, Lieutenant Governor Brent Sanford, all of our cabinet leaders are all reaching out to their constituents. So we got a lot of great information coming in, but we will, when it makes sense, if it makes sense, we will use the power at our tools, the tools and the power that we have to save lives. But right now, we're sticking with the guidance that we have given. But one of the things that we want to do, so transitioning to a new topic, one of the things that we want to do during this time frame, as we've talked about, is continue to amp up testing. We got 2 exciting new things that we're going to be able to do this weekend, and these are 2 things that really aren't happening anywhere else in the country at any scale, where we have proactively acquired enough testing capacity to ramp up our testing, but we've also got enough incremental where we can begin to do what's called surveillance testing. Virtually all the testing that's been done so far has been with people who have presented with symptoms and may also be someone who's presenting with symptoms and has underlying health conditions, or may be in an at-risk age range, meaning older than 60 or older than 65. But this weekend, we're going to begin our first testing where we're actually inviting people to come and get tested who may be asymptomatic, may not have any symptoms. And we're actually doing this in areas that we think can add to the knowledge base of the country, because we're doing in areas that currently don't have much indication of spread at all. It's only coincidental. When we made this decision yesterday to pick 2 locations in western North Dakota, we did this in collaboration, again, working with this idea got hatched in part through a phone call that we had Monday of this week with Dr. Birx, who is leading part of the federal response, but again trying to get some baseline testing in areas that didn't have a widespread. So we're announcing Operation Drive-In Testing Pilot Project. And we've got 2 locations that we're going to be doing this weekend. One of them is in Amadon. If people aren't familiar with Amadon, it's on Highway 85 in Slope County, south of Dickinson. And Amadon did hold for many decades the title of the nation's smallest county seat, smallest by population. They've been eclipsed by some other cities now, but it is still a fantastically small county seat. I think population there is about 22 people. Great people living in Amadon. Marmarth, the big city in Slope County, 140. The population of the county is about 763 on a census from a couple years ago, versus New York, where you may have more than 10,000 people per square mile. Slope County has less than 1 per square mile in this large, beautiful county. But we're inviting everyone in the county that would like to get tested, whether you've got symptoms or not, to show up at in the city of Amadon. It'll be actually at a drive-through location at the community center at the Slope County Fairgrounds is where this will be happening. That's 10 a.m. to 2 p.m. Mountain Daylight Time on Saturday, April 4th, tomorrow. So again, we would love it if we could get a high percentage of people from Slope County. You must be a Slope County citizen to get tested there. And again, even if you have no symptoms, come on in and get tested. If you have had contact with the person that was the one positive reported today, whose name we won't release, but I'm guessing that most people in Slope County have already heard who that is as neighbor-to-neighbor conversation. But if you know that individual and have had any contact with them or have had contact with somebody who had contact with them, again, we would really recommend you coming in because we might be able to catch more cases, through this surveillance testing, as it's called. The second location is going to be in Gladstone, North Dakota. And for those of you that don't know where that is, it's between Taylor and Lehigh. That's a joke. Okay, no, people in Taylor and Lehigh maybe get that, but it's between Dickinson and Richardson, and Gladstone. It's the city of Gladstone, which has got over 300 folks that live there. But it's anybody who has an address of the Gladstone Fire District. So it's really the Gladstone Fire District, which may extend beyond the city limits of Gladstone. But there is going to be tomorrow from 1 to 4 p.m. Again, that's also in Mountain Daylight Time Zone. It'll be at the Gladstone Fire Station. And this pilot project is being conducted by the Southwestern District Health Unit led by Sherry Adams in coordination with the North Dakota Department of Health and North Dakota National Guard. And the goal, of course, here is to gain information to build better models, and it's to help flatten the curve and slow the spread of COVID-19 in North Dakota. What we learn in these two low population, currently low incident counties will help all the other portions of the state, and it could help counties all over the western United States that are similarly regarded. And again, regardless of your exposure, regardless of current symptoms, we want to have you come in. It's all voluntary, it's not required, but if you show up, you'll see traffic control individuals directing you to a public health expert who will give you a mouth swab, and you won't even have to get out of your car. And then hopefully within 24 to 48 hours, we'll call you with results, and you'll be given further instructions. As this is an alert, residents that live in Slope County and residents that live in the Gladstone Fire District will receive a reverse 911 message through the Southwestern District Health Unit, like you might get during a tornado or other kind of episode. They'll give you an alert to say these things are available. For more information, you can again call the Southwestern District Health Unit at 701-290-6110. As people do know, we're in a state of emergency, and we have called up the National Guard for assisting. There'll be about 10 National Guard members. They're going to be on hand tomorrow at these locations to direct traffic and assist the Southwestern District Health Unit and other members from the North Dakota Department of Health. But be clear, because during this time with all this misinformation, if you see somebody in uniform, you may think, this is a military operation, this is a health operation supported by the North Dakota National Guard. The same way they show up and help when we're sandbagging, the same way they help and show up after we've had a tornado or something else. Again, our North Dakota National Guard, always ready, always there, is ready to help out here, and they are not they're not doing anything related to quarantine. They're not doing anything related to restricting movement. They're just a valuable part of Team North Dakota, and they're playing an important role. So again, for residents of Slope County, City of Gladstone, including those in the Gladstone Fire District, we invite you to be there tomorrow to get tested. And again, this is a proof of concept to help us guide and shape further testing on focused populations. If it works here in these smaller populations, then we may be bringing it to the larger metro areas, again, as a way to help us be more focused. And you might again say, why are we doing this? We're doing this because we have to develop the testing protocols and approaches that allow us after the peak to get people back into the workforce. And widespread testing is going to be one of the tools that allows us to move forward. The next topic I want to talk about is we have an executive order today. We've done a number of executive orders related to cutting the red tape to expand our medical capacity. One of the most important roles. I'm sure many North Dakotans, happily did not know what a ventilator was, and now we get to hear supply chain notices about how many ventilators we have or don't have, or who's rushing to manufacture more of those. But the people that operate and run these life-saving, sophisticated, complicated machines that help people breathe when they're in critical care, when they're in an ICU unit, are trained and licensed as respiratory therapists. And we have a number of people in North Dakota, we've learned, that were licensed respiratory therapists that had good standing, and through either retirement or promotion to other jobs, they're still be working in healthcare. They're highly competent, highly trained professionals, but their licenses are currently inactive. We have been working with the State Board of Respiratory Care, and through this executive order, the State Board of Respiratory Care may grant temporary provisional licenses to any respiratory care therapist and practitioners who had a license that was current within the last 5 years. We think this has the opportunity to bring hundreds of more respiratory therapists back into the workforce if needed. Next topic. Has to do, there's been a lot of talk as we headed into April 1st with rent due and all of the economic stress related to the emergency about housing. And specifically, there was a lot of discussion about eviction. Next week, we'll probably be back at one of these talking more broadly about housing, because housing is a huge segment of our economy. And then whether it's someone who's got a mortgage, home builders that are building homes, people that are renting homes, renting apartments, all the small business owners that do rental properties, it's a huge thing. There's over 300,000 housing units in the state of North Dakota, and each one of them is probably suffering something right now because of this economic crisis is touching everyone. But there's also been some confusion about what has or has not been done, actions that were already taken by the state. And we know that housing represents one of our most basic needs, and it ties back to housing, because housing stability is determinant of health and well-being. It's a contributor to stable housing, to students' academic success, and adults' ability to stably stay engaged at work. And we know there's been a disruption across the whole gamut of the housing market, not just for those that might be renting. And so within this, we'll be talking about that more broadly. But today specifically, we've invited Chief Justice Jensen to come here to explain more about actions that the Supreme Court took initially on March 26th, and which they have renewed today. And again, why it's appropriate to have the Supreme Court here, as we've explained in the past, is that in North Dakota, the executive function of managing all the district courts in the states resides with the Supreme Court, and the Chief Justice of the Supreme Court effectively is the chief executive officer of how those courts are managed. And the Supreme Court met again today, and so we welcome back Chief Justice Jensen to give us an update as it relates to evictions. Chief Justice, thank you for being here.
Thank you, Governor, for giving me an opportunity to explain our order. I do appreciate that. And there has been some confusion with regard to our order, and specifically with regard to how it impacts evictions. The eviction process is a multi-step process, the first of which requires a statutory notice that the eviction process is going to start. That's not a judicial process, and if I look at number 1 on this slide, it appears to be the first item on that slide, which is again 3-day notice of intent to evict. That's just notice to the tenant, providing them with information that they are in violation of the terms of their lease. That could be for a variety of reasons, one of which is non-payment, but there could be other reasons like they're being disruptive, or they've been engaged in criminal activity, or something else that violates the lease. The response to the 3-day notice of intent to evict can be one of two things. If the tenant provides payment to the rent, the process stops. So again, the 3-day notice of intent to evict in non-payment cases is to provide the tenant with an additional opportunity to pay the rent. The other is the tenant can vacate the premises. That's what the 3-day notice of intent says. You can either catch up on the payment or you can vacate the premises. If the tenant does neither of those two things, then the court process starts. So up to this point, the judicial function hasn't begun. And if you look at the second item on that slide, the eviction summons and complaint are prepared and they're served on the tenant. Up until this point, a tenant cannot be forcibly removed from property. It's only after service of the summons and complaint and then appearance before a judicial officer can there actually be a forced eviction. In North Dakota, we have a statutory process that tells us that you have to give the tenant at least 3 days notice before that hearing in court and no more than 15 days. And the caps on those are on the bottom end is to provide the tenant with an opportunity to prepare for that hearing. On the other end, it's a summary process that allows landlords to go through the process fairly quickly. And let me compare that to other, and this will explain why the North Dakota Supreme Court took action specifically with evictions. Evictions are one of those rare hearings under North Dakota law that have very prescribed timelines. Okay? And we have a number of types of cases that do that. In most civil cases, when you file a case, the judiciary, for the most part, sets the timelines. In evictions, the legislature has set the timelines and set those timelines within a very small window. 3 days at the beginning, 15 days as the ending point. If you look at the orders that the North Dakota Supreme Court has issued, you'll see that criminal proceedings also have very quick deadlines, either constitutionally, by statute, or by rule. And so we issued, our initial order actually handled criminal proceedings. Juvenile proceedings are much the same. If a child is in foster care, we have very prompt deadlines for reviewing those cases and repeated deadlines for reviewing those cases. Again, mental health, protection orders, all of those have statutory or rule-based deadlines. Evictions were the same. So we weren't treating evictions necessarily specially. We were treating them because we needed to address those very prompt statutory deadlines. And again, one thing that I think is not as clear from our order, but is probably clear to attorneys that deal with evictions, is without a hearing, there can't be a formal eviction. Without a hearing, there can't be a forcible removal of a tenant from property. So through the suspension of residential eviction proceedings, the eviction process has stopped. Until the court removes the suspension of residential evictions, the actual removal of a tenant from a piece of property can't occur. So again, we've taken that action, and we think it's an appropriate action. Again, we're treating that very similar to what we did other case types that have very specific deadlines. So at this point, with regard to removal of tenants, no additional action, I believe, is necessary. One of the things that, if I can just depart to another topic just for a moment, Governor, and I realize that I asked you if I could come talk about evictions, but there's one other topic that I think it's important to talk about, and that is parenting time orders. This week, the court did issue some guidance with regard to parenting time orders. The first thing that I want to do today is say thank you to the vast majority of parents who have parenting time orders that are working together and ensuring that children have access to both their parents. That is by far the greatest number of cases that we have. Our focus tends to be on problems, and sometimes we forget to acknowledge folks that are successfully navigating through this emergency. But we realize that the emergency does create some confusion with regard to parenting time orders. So this week the court issued a statement which made it clear that you need to follow those parenting time orders even though there is an emergency. And again, we realize that there may be circumstances under which that may not be in the child's interest. So the court also expanded its mediation program, providing that without cost and within a very short time frame to address any issues that are left. So again, if we look at the scope of parenting time orders, a big thank you to those, the vast majority that are being resolved between parents. The smaller amount that we believe that we've clarified with our statement this week that would reduce that amount even more, and then even reducing any further dispute with our mediation program. We hope that there are very few orders left that would require some type of judicial intervention or enforcement. So again, Governor, I apologize but it's an important topic for the court, children, and I appreciate the additional time.
Thank you, Chief Justice, and if you could stick around. Usually you're the one that's listening to the questions as opposed to, or directing them, not asking them, not being asked, but it'd be great if you could answer some questions afterwards. But again, thanks, Chief Justice, for talking about the suspension of eviction proceedings and then also providing clarity for parents and children. So really appreciate your being here. As it relates to housing, and we'll talk more about this next week, but as people are, during these times of uneconomic certainty, again, some encouragement that we want to provide to property owners and property managers, and also some encouragement for tenants. But the number one thing is, if you're a tenant that's, particularly if you're affected by state mandated closures, bars, restaurants, nail salons. All the things we've said. Hey, we're asking that you close. Notify your landlord or your property management company that you've had a change in your economic situation. That would be number one. Number two is we're going to hear more about all the economic programs soon, but I would dig into all the economic programs because there's many ways that you may qualify for the new programs that came out of the CARES Act. I would also, again, understand that some of that eligibility, people may, depending on their income, be eligible for low-income heating and energy benefits, which they may not have realized that they were. And also you could, as a tenant, talk to your landlord and say, I can't pay it all I can't pay it all right now, but I can pay some. I can pay more later this month when my unemployment starts or some other benefits. But the key thing is to be talking to each other, and then you can avoid the whole court system approach anyway, which are for right now suspended, but you can avoid all that, even down the road. For property owners, again, the same thing. I think that I've heard from a number of folks that are out there that understand that they've got their marketing departments that were very busy trying to get people to rent space in their buildings and put that marketing team to work on your tenant communications, your customers that are there, and make sure that you're communicating with them during this time of stress. And again, I think that as when we've got softness in the economy, I think that we'll see that depending on the competition that happens in the private housing market, just like it is when we've got excess housing, then you see people start to offer, hey, we'll give you 1 month free, or we'll give you this, or we'll give you that, or we'll waive these fees. We're going to start to see a lot of that. And again, depending on their situation, property owners and property managers will be doing that because they're going to be competing for what may be a smaller pool of renters going forward. So this is a time for communication. It's a time for those people that own property to think about they're going to have to reinvent their business models, just like lots of other folks have had to reinvent business models during this time of stress. But again, we know that preserving and promoting housing stability during times of uncertainty is important to the overall, health of our state. And so again, without government mandates here, the Supreme Court's taken great action to effectively eliminate evictions in North Dakota during this emergency. But we would encourage everybody, depending on your own situation, to communicate. And if you're someone who's out there that, if you work for state government, working from home, everybody's getting a paycheck. If you're a teacher, superintendent, working in a school district, there's been no loss of pay for anybody that's involved in K-12 education, no loss of pay for anybody that works for any of our universities. There are people in healthcare that are working extra hours and probably doing that very heroically, but getting paid more. There's some in healthcare that are working less hours. So it depends really on your own situation. But again, that's why it's important for renters to talk to owners, communicate with each other, and work through these situations. The next topic is we're pleased to have joining us today by telephone is Michelle Comer, who leads our Department of Commerce, and she's going to give an update on some elements of the CARES Act and economic assistance and help everybody understand even more. There's so much in the CARES Act, and whether it's direct payments, whether it's small business loans, whether it's loans for larger organizations. Again, no time in history has this much economic assistance been available, but some of it is brand new, and want to make sure that we keep getting information out to help people through this time. But great to have you with us. Thank you, Michelle.
Thank you, Governor Burgum. As Governor Burgum said, my name is Michelle Comer, and I am with the Department of Commerce. In the past month, the department has been remissioned to support North Dakota businesses. As you have heard, with the signing of the CARES Act on March 27th, more than $2 trillion were made available to support and stimulate the economy. Of this, $349 billion were made available to support small businesses. Today, I would like to be certain that the business community is aware of two types of financial support in particular that are available for small businesses through the CARES Act, as this money is first come, first served, and we want to position North Dakota to be first. This is important because if businesses can continue to operate, they can continue to pay their employees, and our entire economy benefits. The first type of financial support is called the Economic Injury Disaster Loan. The acronym we're pronouncing EIDL. The purpose of the EIDL is to assist small businesses in paying business expenses that cannot be paid due to COVID-19, such as payroll, accounts payable, and other working capital. This loan is available to small businesses, including startups, nonprofits, sole proprietors, independent contractors, cooperatives, and ESOPs with less than 500 employees. These loans will be available through the end of 2020 or until the money runs out, which will likely be sooner. A feature that I would like to emphasize for businesses that need help right now is a $10,000 emergency advance on the EIDL, which is delivered within 3 days of loan approval. This is a low-interest loan, and the maximum loan per business is $2 million, with a repayment term of up to 30 years. To apply for this loan, you can go directly to covid19relief.sba.gov. That website is live right now. The second resource is called the Paycheck Protection Program, or PPP. The purpose of this program is to help businesses avoid layoffs, as the loan proceeds are intended to be used for payroll and other operating expenses. The PPP is available to small businesses with less than 500 employees, as well as tax-exempt nonprofit organizations, sole proprietors, independent contractors, and self-employed individuals. Guidance should be consulted for certain exceptions. These loans will be only available through June 30th of 2020 or until the funding runs out. The maximum loan amounts for each company will vary depending on the company's payroll size. Guidance delivered just last night says this amount is generally 2 times the average monthly payroll over the past 12 months. This total loan amount cannot exceed $10 million per company. This loan is forgivable under certain circumstances, including that at least 75% of the loan proceeds are used for payroll in the 2 months following loan origination, and less than 25% are used for non-payroll costs. The interest rate on the PPP loan is 1%, and the term of that loan is up to 2 years. Unlike the EIDL, where you apply online directly to the SBA, this loan is available through your local lender. As I mentioned, guidance was just released last evening, including the application form and the lender's portal. So today is the first day that these loans can be made. A business can utilize both of these resources, so long as the proceeds are not used for the same purpose. For example, if you apply for the EIDL to pay April payroll, you cannot also apply for the PPP to pay April payroll. Again, it is important to note that these loans are first come, first served. So if you are a business owner in need of financial support to manage through the disruption caused by COVID-19, you should consult your accountant and lender as quickly as possible to determine which one or both of these financial resources is best for you. We note that as of 9 o'clock this morning, U.S. Secretary Treasury Mnuchin said that community banks had processed 700 loans for $2.5 million even before 9 a.m. And just an hour later, he said the total was up to $4 million, which is a sign of significant demand. With this program being so recently released, we know that North Dakota lenders are working hard to ensure access for borrowers, and we ask North Dakotans to work quickly and together. For more information, please visit our website at ndresponse.gov. Click on the red COVID-19 resources banner, then select Business and Employers button. Under the financial section, you will find all of the information that I have discussed today, along with resources that were curated just for you. Additionally, you may email questions directly to the Department of Commerce at businesshelpcovid19@nd.gov. While we cannot provide you financial advice, we can help you navigate the resources that are available to you. Finally, to learn more about this information and other updates relating to the CARES Act, I invite businesses to join us for our 3rd weekly business briefing this coming Thursday, April 8th at 11 a.m. At yesterday's briefing, more than 2,200 business persons attended. Next week, we will be discussing the newly released guidance for the Payroll Protection Program, along with other CARES Act implementation updates. You can register at ndchamber.com as we are partnering with the Greater North Dakota Chamber of Commerce to deliver this business briefing. You need not be a member of GNDC to join. I just want everyone to know that the Department of Commerce is here to support you. We are in this together. Thank you so much, and I'll stay on for questions afterwards.
Thank you, Michelle. As you've just heard, tremendous opportunities for economic support during this emergency, but lots of programs and lots of new information. So take advantage of the website and take advantage of dialing into the webinar again next week. And I would also, as Michelle said, act quickly, because some of these, well, the programs run through June. It's possible that that the federal dollars could actually run out, and so it would encourage small business owners and individuals to use the time you have right now to get up to speed quickly, so that you can be at the front of that line. Some of you may have noticed that, again, likely I'm wearing blue again today, but this April is Child Abuse Prevention Month, and today is actually Wear Blue Day, an opportunity to raise awareness and celebrate the important role individuals and communities have in protecting children and strengthening families. Because of the pandemic, families are coping with school and workplace closings and added stress. Social distancing remains important for stopping the spread, but we know it can increase the risk of isolation and impact well-being and make parenting more challenging. As I've said before, when we're trying to keep physical distance, this doesn't have to mean social isolation. There are many actions that we can take to strengthen and support families. You've heard me make these suggestions before, but connect with the families that you know, connect with old friends, call them, message them, use social media, and again, my favorite, which is write a letter to someone that made a difference in your life and share your gratitude with them. We've talked about, again, going outside is a good thing. Take a walk with your pod, the people that you're living with, and wave at your neighbors from a safe distance. Yell at them and ask them how they're doing and if they need anything. But again, to keep your neighborhood going, there's lots of ideas out there about how to, the neighborhood level and sort of pod level ideas of how to stay connected during this time. And again, giving is always good for the giver as well as the receiver. As we've shared earlier and yesterday, again, local charities who've had to cancel events are also under strain, but you could call them or go online, find out how you can help them. We've talked about parents.lead as a website to go to through North Dakota Behavioral Health, but there's things that you can do during this time of stress. Kids listen to what parents talk about. If parents are only talking about their worries about economic concerns or health concern, you can transfer a lot of anxiety and stress to children. And we know that April is around in many states, but also in North Dakota, April is the month when we have the highest amount of suicides. So again, extra care and patience and kindness can go a long way. But if you have ideas to strengthen your family that don't involve a Netflix subscription, pull out some old family photo albums and talk about family history. Pull out pictures of people in your family that, grandparents or great-grandparents that you maybe haven't talked to your kids about and share stories. Cooking together is a great activity, and there's a lot of opportunities to just talk about both math and chemistry if you're really into cooking. Reading books together, always great, particularly for young people that are in preschool. The number of amount of words that they hear during their early formative years is often an indicator of how well they do in school. So if you haven't had time before to read a book with your kids every day, this is a great time to start that habit. Play games, do puzzles, arts or crafts together. I mean, we saw that how putting hearts on windows became a worldwide phenomena that started with kids here in North Dakota. And there's even been some great, I know a Texas radio station did a virtual dance party where they put out some great dance tunes and everybody danced at home and posted videos of themselves dancing all at the same time on a Saturday night in a small town in Texas. So lots of ways to do that. Again, if you're just letting your kids go online, again, we still have to be safe about online because we talked yesterday about scam artists going up. There is likely to be an increase of online predators who might also take advantage of this crisis too. And make sure that you as a parent take care of yourself, whether that's walking or exercise or yoga, meditation. Do the things and give yourself time for self-care. And again, sadly, we don't like to think about child abuse. We think about that's something that happens in some other place and not in our state. But as part of our housing work group this morning, it was, I think, shocking for me to see that a stat that I hadn't seen as governor, that there was 5,712 people that checked into domestic abuse or domestic violence or sexual violence shelters in North Dakota. 5,712 people during 2019 went to a shelter because they were concerned about their own safety. And now we're in a period of even more stress, and so again, we have to be even more, I guess, alert because during people that are in abusers, the thing that they like to do is isolate the people they're abusing to keep them out of circulation. When we're asking people to be self-isolated, this is a breeding ground for more domestic violence and sexual violence, and we want to make sure that we don't come out the backside of this thing. So again, if you want expert resources at nd.gov/DHS for our Human Services website is one place to go. And then crisis programs, caws.northdakota.org is where you can get more information about the local crisis programs in North Dakota. If you've got concerns or that you have some suspicion that a child is being abused or neglected, as always, you can call your local human service zone officer, which are zone offices formerly called county social services, but we've reorganized those into zones around the state, and contact information again at www.nd.gov/DHS. But if you think that a child is in immediate danger, of course, as always, just call 911 or contact law enforcement if you think there's immediate risk. So again, this is Wear Blue Day, and again, this is about Child Abuse Prevention Month. Really an important time for us to think about the children in our state as we go through this crisis. In terms of unemployment, on the daily update here, yesterday, Thursday, we had another 2,555 unemployment claims filed. So that number continues to race skyward. That brings claims to 32,602 since March 16th. On Tuesday, we announced the Workforce Coordination Center. Again, whether you're out of work, retired, recently out of work, just want to help, want to volunteer, please consider that. We're looking for both volunteers and paid staff. And again, you can find that through the Job Service North Dakota Workforce Center. We've moved that website. So again, just go to our one central location, ndresponse.gov, and you'll find information about the Workforce Center. That brings us to the conclusion of our remarks, and we'll take questions. And again, Michelle can take them online. Chief Justice will be here to answer questions about his topics. And I see that Jack Dura from the Bismarck Tribune has got his hand up. Jack?
Governor, I'd like you to respond to a tweet from the Capitol reporter in Minnesota. This is a quote from Governor Tim Walz, his press conference today. I do worry about that. Governor Tim Walz says of Iowa, North Dakota, South Dakota not yet issuing stay-at-home orders. He says he expects they will make that move going forward.
And I missed the last part of that, Jack. He
says, I do worry about that of Iowa, North Dakota, and South Dakota not yet issuing stay-at-home orders. He says he expects they will make that move going forward. Individual responsibility.
I do talk a lot about individual responsibility, and I think one of the great things about America is that we've got 50 states that created the federal government. The federal government didn't create the states, and I think each governor has to lead their state in the circumstances that they have. And you're going to see a variance in strategies and implementation of those strategies, but I'm positive that every governor does care about the health and safety of the residents in their state. But we each of us also have got unique demographics and unique geography and unique population densities, and we've all got different curves in terms of when the spread is occurring. And I think we're fortunate here to be in the Dakotas. We're at the tail end of this thing, where where it is will likely peak and subside in other states later, and so we're on different timetables too. But like I said earlier, we've got we're staying today with the mandates we've put in place, and we've got the tools, and we're willing to use them if need be, but we're going to do that if and when it makes sense for North Dakota. Lane?
To kind of go off of that, Doug from Fairview wanted to know what are some of the benefits of not putting a stay-at-home order or locking down the state entirely?
Well, I think some of the benefits relate back to some of the things we just talked about, because for every action there's a reaction, and for things that we do there's consequences, and then there's also unintended consequences. And so we have to think about all of those things in their totality. And what we keep talking about, what really matters is, are we seeing a reduction in transmission? And one of the things we will talk about more as we dig in more into the data, but at least some preliminary information I heard just before walking down here, is that by some measures, traffic activity may be down by 44% in North Dakota since we put in these orders. I mean, it's possible that you could have a state that's got a stay-at-home order with a long list of exceptions that's actually got more contact, in higher population areas, people transmitting at higher rates than are happening here in North Dakota. So again, as I say, we got to look beyond the labels and in to really look at the real measure of that activity, and we're going to keep trying to get more precise about that. We've got some ideas about a cell phone application that could be broadly used, not just in North Dakota, but around the nation, that might help us get more data on that. But what we're, right now, I'm a believer that we need more individual responsibility, not more government mandates. And the benefits of more individual responsibility is that people get a chance to exercise the things that people have fought and died for in this country, which is, freedom of choice and all the home ownership, things, the benefits of having your own home, owning private property, all that. I mean, I think when we get out of this thing, 2-3 months from now, I won't be surprised if there won't be lawsuits that are brought that say that some of the orders that were put in place actually weren't constitutional. And so in the end of the day, it is, I think, really comes down to, again, which I've said before, it's not what happens in D.C., it's not what happens in Bismarck or any other capital. The spread of this virus, which is 15 times more fatal for elderly people with underlying conditions than the flu, the spread of that is all going to depend on the individual responsibility of citizens, and that's what we're going to keep talking about, because you put out rules and then from the government and people say I don't want to follow them, then what do? Then you get more police trying to enforce rules and you get more contact with more people. I mean, let's just figure out how to be North Dakota smart on this one, and maybe we can outperform in terms of contact with the, a great goal would be the least amount of transmission and the least amount of government mandates. That'd be the box, if you had a 4-box quadrant with government mandates on one side and transmission rates on the other. We'd want to be in the low government mandates and low transmission. That'd be the winning box. Maybe that'd be the upper, low and high opposite on the 4-box matrix. But that's where you'd want to be, and I think we can get there. So we'll keep driving that. But it's up to you, North Dakota, to make that happen. We want to make sure that we can keep doing what we're doing, but that takes individuals. But thank you for that question. I'm going with Dave Thompson from Prairie Public, and then Jacob, KFYR.
This is about the testing, the drive-through experiment this weekend. If it turns out to be successful, how quickly can you ramp it up for other areas of the state?
Well, we're working hard on a supply chain front to make sure that we've got all the testing supplies we need to keep doing what we're doing, which is testing those people with that have, the symptoms, those people that are on the front lines, medical workers, all the guidance we've given before about who needs to be tested. We want to make sure that we're able to test everybody that meets those requirements. And now with that little extra capacity that we have to go out and start doing surveillance testing. And again, the people that we're inviting tomorrow, well, again, if you've had symptoms, we would love to have you show up. Voluntarily, even if they think they're mild symptoms. If you've had contact, if you've got, a college student that came back from a hot spot that's living with you, if you've recently traveled, show up, do your part, take the mouth swab, very painless, don't have to get out of your car, but help us get the information of the spread, even in areas where we've had relatively low testing and in some cases no positives yet, or one positive in the case of Slope County. But if we have the capacity to do that and we're learning stuff, then we could go to other populations, and and those populations could include, elder housing, long-term care, tribal areas, larger metro areas. There's a lot of different ways you can design testing research, but we've talked about all of those, and we've talked about them with the administration in D.C., and we, again, want to be someone who can be a contributor to the knowledge, because these models are all over the map in terms of outcomes, and the thing they're all missing is more data. And so part of what we're trying to do is save lives and save our economy with better testing. Jacob?
Governor, oil bounced back ever so slightly. It's bouncing around in the high 20s. You mentioned that it's a difficult time to forecast state budgets, but are there any stress tests in place to at least gauge where there might be a point where serious decisions have to start being made budget-wise?
Absolutely. And we've had discussions this week. We had a call, Lieutenant Governor Sanford and I did, with House Majority Leader and Senate Majority Pollard and Wardner. On Wednesday, there was another call this morning with Brent Sanford with them discussing. We, I think, are in agreement that there's no need now for any kind of special session, but we are in part of that is we have to absorb all the information about what's the impact going to be on North Dakota from all of the money flowing from the federal programs, but it also gives us a chance to, get through. We've only really been through about 3 weeks, and then you've got lagging on collection of everything from gas taxes, as you mentioned at a prior conference, to sales tax, with income tax being deferred. A lot of variables are changing in the models, but Joe Morissette, who leads OMB, and our office, working very, very closely together to try to, recast the forecast that we had in place, and we'll, continue to evolve those. But as you talk about getting a little bit of a reprieve, I mean, you can get from 20 to 30, that's a 50% increase, and we'll take it, because that is one of the big drivers in our budget is the revenue that comes from oil taxes. I want to remind people that are here that we got Michelle Comer and Chief Justice here, who'd be happy to take a few questions. We'll take one from online.
Jean Schemp with Hometown Radio Group in Minot and Bottineau. We've had reports of high-risk medically vulnerable employees being required to continue reporting to retail jobs. What can a medically compromised employee do if their boss insists they continue to work with the public?
High-risk individuals being forced to work. I think, I'm trying to say, talk to your employer, first of all. There's so many people that are willing to work. I would think that we'd be able to fill all the jobs without having to put high-risk people on the front lines, and probably be good for business to not be doing that. But again, if that individual, there may not. Again, I don't know the specifics of this, so maybe call Erica Thunder, who leads our Labor Commission, as a place to start, Labor Commissioner, to see. There may not be anything quote illegal going on, may not be a great business practice during this time, but again, most companies probably don't have in their employee handbook and employee rules, here's how we're going to operate during a pandemic, or here's who we identify as high risk. So this goes back to every business has probably got to pull out their employee handbook and think about, how do they want to update that to reflect the unique circumstances that we're in. But again, we want to protect high-risk individuals, and there's, again, with the federal support that's here, there's a lot of ways to support people that are temporarily unemployed or not working, and so there may be a solution to do here that can work for both the employer and for the employee. But again, we have to get into the specifics. But okay, back to Jack and then to Jacob.
Governor, would you mind detailing some of the federal funding that the Emergency Commission approved yesterday? That was kind of the initial distributions from the CARES Act, as well as some other federal money.
Yes, the Emergency Commission met yesterday and approved some of the initial tranches in aggregate. Some of those came in related to Department of Transportation. Some of them came in related to Human Services. In Human Services, they were funding for some of the existing programs that we had. Some of them, conveniently, there was money in there for child care, and that could be used. We had prior to the CARES Act, the full understanding of all the details in that passing. We had put together the child care operating emergency grants, but some of that federal money could backfill and help be support to help pay for that. Some of it is in the change of how a complicated acronym called FMAP, but that's the percentage of federal reimbursement that the state receives related to Medicare. That was moving up 6.2%. We were slightly over 50. Low per income states might have had a much higher match where the federal pays more and the state pays less because of the economic success of North Dakota in recent years. We were among the quote wealthier states, and so we only got 50, was basically 50-50, slightly above 50, but with that 6.5% more even over three months, or over 6 months, over half a year, that's $30 million to help pay for additional federal insurance. So that's a good thing. But the way it works again in North Dakota and a lot of states, when you receive a check from the federal government that comes in, and you've got our legislature, which is the group that sets the budget and makes the appropriations. When those levels are set, then agencies and cabinet or elected officials can't spend above their legislative appropriative levels. So the point for the Emergency Commission is to get together and then make the initial recommendation and initial approval that a agency can receive those federal funds and expend those federal funds, and so that was the step that was happening yesterday.
Just one follow-up: how quickly could those funds be put to use here in North Dakota once the budget section would be expected to approve them next Tuesday?
Well, you bring up a key thing, because the way we're set up right now through is there's actually a two-step process, because after it goes to the Emergency Commission, then it has to go to the budget section. I believe the legislative leaders are calling a budget section meeting on Monday, possibly as early as Monday telephonically, where they would get together, review what has passed through the Emergency Commission, and once that has passed, then when the federal funds come in, then they would be able to be expended. In some cases, in the case of what we're doing on with the emergency management, where if we've got needs that we have to spend on now, they also authorized the approval for borrowing for emergency management services to borrow as much as $30 million from the Bank of North Dakota, which then could be repaid when the cash flows come from the federal government. So again, we were fortunate to have the Bank of North Dakota appreciate the unanimous support of the Emergency Commission, which I'm honored to chair, but includes 4 legislators and then the Secretary of State. So we had 6-0 votes on all of these supporting these emergency funds. But with the Bank of North Dakota, we can potentially, if we need to pay a bill right now, say to get PPE, to get equipment for more testing equipment. If somebody says, hey, you can only get that if you pay cash, we got the ability to do that right now through the borrowing from the Bank of North Dakota, and then the federal funds will fill in on the backside. But
would that money come from the presidential disaster declaration to repay that loan from the Bank of North Dakota?
It depends. Depends on what's expended against. Some of it could come through that. Some of it could come through some of the relief that's being provided through the CARES Act. Because in the CARES Act, they're even included some specific things for DOT, and the DOT stuff included supporting transit in our rural areas, because we do provide transit. Say someone's doesn't have a way to get from a rural area to a hospital, DOT has got services that go out through transportation services in the state that we support, and then there's a separate line item for transit in large metro areas, because we know for people that don't have automobiles during this time of emergency, we've asked all of our metro areas to keep their transit going, but using the appropriate distancing and sanitation within those. But yeah, there's a variety of things, and I know that if we didn't put one out, we'll get one out that's a detailed press release on everything that went on in an emergency commission. From online?
For the Chief Justice.
Yay, question for the Chief Justice. Thank you, whoever you are out there. Way to go.
Thomas Simon from Williston Trending Topics News. If someone is unable to pay their rent and allows the time period to cure expire, once you lift your eviction suspension, will they get another chance to cure, or will the eviction proceedings continue from that point?
they'll have to schedule a hearing. So there would have to be a summons and complaint and then service of that summons and complaint. The quickest that there could be a hearing is the 3 days. So after service, it would be 3 days. And depending, if you look at the order actually that the court entered, you'll notice that we actually expanded the back end of it up to 45 days. And that was to increase flexibility for our district court judges as far as scheduling those. So the short answer to the question is, in a way, because the quickest that a hearing could be held is 3 days.
Do you have another question for the chief, or no?
I have a question for Michelle Comer if she's on the line.
Yay, Michelle Comer, are you on the line?
I am.
Question from Jacob from KFYR.
Ms. Comer, with these, if a small company is applying for these SBA loans, given the financial uncertainty and the timeline uncertainty, how long should companies expect to rely on these loans, and are they meant to help companies succeed, or are they meant to help companies survive this time?
Well, Jacob, I'll try to answer the first part of your question first, which is, I believe, the timeline of the funding. And we're not certain of the timeline of the funding. That's what we're working on right now. U.S. Treasury Secretary Mnuchin indicated that he expected both programs to be moving money within 3 weeks of when they were approved. The EIDL was approved in the middle of March, and the PPP was approved on the 27th. So we're still waiting to hear and very hopeful that those timelines are met by the federal government. And they have met the predicted timeline for the launch of the PPP, so I'm very encouraged by that. And the second part of your question is, I'm going to speak first to the Payroll Protection Program. The whole purpose of that program is to assist employers in keeping their employees employed. And the thinking behind that is, if we're able to do that, then recovery, as we work through the health crisis that we're in right now, will be easier. So I hope that answers your question, but the EIDL and the PPP both allow for the business owner to pay payroll and operating expenses, recognizing that we have had an unprecedented and sudden disruption in many industries all across the nation.
Thank you.
Dave?
I'd like to do a follow-up on that, Michelle. With the PPP, what do you expect the demand is going to be? And, well, we'll leave it at that. What do you think the demand is going to be for that?
I think the demand is going to be extraordinary. I have been reading articles today, including the one that I shared with you earlier, where Treasury Secretary Mnuchin shared with us at about 9 o'clock this morning Eastern time that they'd already seen millions of dollars in applications. I'm understanding from other things I'm reading today that the smaller community banks, which North Dakota is blessed with an abundance of, are being very nimble and reacting extremely quickly, and the larger banking systems are moving a little bit more slowly. However, the Bank of America reported earlier today that they had billions of dollars in the pipeline in terms of requests. So I do predict, as have many, that the funding will run out long before the deadline.
Lane?
A viewer of ours was wondering, he just had a recent kidney transplant, so he's unable to go to the store and get it, his groceries, but he's also unable to get them delivered because he gets them through SNAP. So he's wondering why that is, that it doesn't cover the delivery fees, and if there's anything that can be done to change that.
Well, first of all, I am happy to hear that he got through his surgery well, and it's been a long-standing federal requirement on the SNAP, or the Supplemental Nutrition for Families, and program is that they would pay for the food but not for the delivery, because they want to have all the federal dollars going towards paying for nutrition. So that's a reasonable reasonable thing. During these times, again, this is I'm sure this request has popped up all over, but I think right now, without a change in federal reimbursement on that, then this is where opportunity for a neighbor, local charity, somebody that could, and again, I know some communities are trying to create within their own community, in their own neighborhood, places to connect with each other to help out people, but this would be a perfect situation because you got someone who's recently gone through a surgery where you want to avoid infection, then it'd be great if somebody else was picking up their groceries and dropping them off on his doorstep for him. So it may be again, I don't know if we're looking for volunteers for that workforce coordination center, but maybe we can get his name and see if we can connect him with a volunteer to help that, because those are the kind of people that we want to have them. They would, regardless of age, if you've just gone through a kidney transplant, you would be considered someone that would have an underlying health condition for right now. Last question.
Scott Hennon with WZFG and KFYR Radio in Fargo and Bismarck. President Trump and Senator Kramer are hosting oil industry leaders today to discuss our response to foreign dumping and to get oil prices up. What kind of a response would you like to see out of this?
Well, one thing we've talked about before was during this period of low prices, and maybe we missed an opportunity last week to save Americans billions and billions and billions of dollars when we're printing money and doing important economic relief, is the thing called the Strategic Petroleum Reserve. And the Strategic Petroleum Reserve is again something that would help the United States if we ever had a disruption. Even though we're a net exporter, the key word there is net, because we import a bunch of oil and we export a bunch of oil. If we ever got to a spot where we had to rely just on the stuff that was here, we would be wishing the Strategic Petroleum Reserve was filled to the max, and a way to save money would be for the federal government to be buying oil when prices are low, and again, that fell to politics during the recent CARES Act. It was in, it got taken out because people have got, there's politics around energy. It got taken out, but it was a great idea. It was supported by the White House, but to get the CARES Act passed, it got pulled out. So one of the things that I think would be great to get put back in is when you're, below certain price levels, the government should be buying. I mean, that just makes sense for every American and every taxpayer. You have to separate the price you pay for energy and with, conservation. I mean, you can still be for great gas mileage on cars. You can be for let's have a clean environment, and you can also be for saving money for the American taxpayer, because we aren't going to be able to, rejigger the entire fleet of American automobiles overnight to not using transportation fuels. And so given that that's not even a possibility, then it would just make complete common sense to be using federal dollars to be buying and filling the petroleum reserve. So that'd be one thing. But again, what the congressional leaders and what Senator Kramer and others have been working on, again, when we've got these international oil markets competing with each other versus OPEC, working together to try to restrict production, then when you have this kind of demand shock plus the there's always been geopolitics around oil, but combining the two together is a challenge. But with markets up, there must be some optimism that there's going to be at least enhanced coordination among OPEC as opposed to the kind of mutually aided destruction path that they've been on the last few weeks. With that, I think that's our last question for today. Again, thank you for being here today. In terms of the announcements for whatever we're going to, at current rate today, we're not having a live press conference tomorrow. We'll handle news and updates. The 11 o'clock update on number of cases, that will go out tomorrow morning as usual. And then tomorrow, sometime tomorrow afternoon, based on what we're seeing, we'll give an announcement on whether we have a live conference on Sunday afternoon or not. So stay tuned for that. There'll be plenty of notification that we'll give you on that. But we right now now, we'll plan on not seeing you tomorrow. For sure, we'll be back Monday at 3:30 here with the live press conferences again next week, and we got a lot of topics to cover next week. So thank you all for your part in helping get great information out to the citizens in North Dakota. And for those that have been watching all the way to the end of these things, again, thank you for being part of that great North Dakota community. So be North Dakota smart, stay home, stay healthy, stay connected.